Well, good afternoon. Thank you very much for coming. We really appreciate your time and efforts. I wanted to make an announcement today here at the University of Kansas Health System. Through the selfless and generous acts of 5 donors, we were able to complete a 10 kidney chain, 10 people. 5 people were transplanted in the past couple days. All of our donors are doing well. My name is Sean Kumer. I'm the Vice President of Operative Services and also a transplant surgeon, and I perform the donor operations, and all of our donors are doing excellent right now. And I'll hand off.
Thanks for coming. I'm Tim Schmitt. I'm Director of Transplant at the University of Kansas Hospital, or now Health System. I would agree with Dr. Kumer. I think without the generosity of donation, which is really the foundation of transplant, we would not be able to accomplish this feat. You know, to help 5 patients come off of the transplant list and get kidneys is quite a feat. And it took the dedication of a lot of people. I mean, a lot of people went to work and put together this chain. Dr. Kumer and myself were the kind of like the final straw. We got to do the transplants, but the hard work really was organizing, getting everything done, getting prepared. We couldn't have done it without a huge team around us and support of the health system. But, you know, like he said, most of all, if it wasn't for one person to decide to give their kidney and expect nothing out of it, we couldn't have accomplished this feat at all. I saw the kidney transplant patients today. They're all doing great. They're all smiles. The kidney function is working great. And we're just happy that we were able to do this successfully and hope to do more of this and help people get off the transplant list. I'd like to introduce Amna Ilahe. She's our Kidney Living Donor Director. She'll have a few words as well.
Hi. So living kidney donation is one of the best gifts that any kidney patient can receive. Whenever somebody brings an eligible donor, sometimes they are unfortunately not compatible because of either blood type incompatibility or antibodies. So kidney pair donation is a very safe alternative in these patients, in which the incompatible donor gives to a complete stranger, and in return they receive a kidney for their loved one. University of Kansas Hospital has done a few national swaps successfully. What makes this internal 5-pair chain very special for us at the transplant center is because in this 5 pairs, all of the pairs included were from the University of Kansas Hospital at our center. Because of the generosity and selfless act of one altruistic donor, we were able to start a chain where those incompatible pairs sitting with us waiting for a match were able to exchange kidneys, resulting in 5 transplants, which would not have been possible otherwise. We are very humbled to be a part of this and very appreciative for all the donors. It took, as they said, a very large team for this to happen. Our donors and our very skilled surgeons made this happen successfully, and everybody is doing very well. Now, Dr. Cibrik is our medical director for kidney and pancreas transplant, and she'll say a few words.
Good afternoon. I'd just like to echo the same sentiments that were already presented by my colleagues. These 5 kidney transplants that were performed here at the University of Kansas Transplant Program are a great example of one of the benefits of living donation. 5 people were able to either avoid dialysis or to get off dialysis through the generosity of these donors. Our goal at the University of Kansas Transplant Program is to increase living donor awareness and to educate our patients and our families about living donation. Hopefully to increase the number of living donor transplants that we can do here. One of our initiatives is to, by partnering with outside organizations and with other transplant centers within the region, we can increase the living donor pool and hopefully increase living donation as well as a kidney transplantation indirectly. Although we are so happy that we were able to do these 5-paired exchange here, the 5-pair chain, the real heroes are our donors, and the generosity of these donors cannot be, it's a great thing that they did for us. Okay, thank you.
Hi, good afternoon. My name's Jaime Bartley, and I'm the nurse manager for the kidney transplant program. Our transplant team is dedicated to helping as many patients as we can find a kidney transplant. This transplant chain took extensive planning and preparation. All of our patients completed thorough evaluations to determine if they were eligible to give or receive a kidney. All were eligible. However, as you've heard, many donors were not a direct match for their intended recipients. The incompatible pairs were listed in the National Registry to search for exchange options at other transplant centers. Additionally, our transplant nephrologist and nurse coordinators worked to look for possible exchanges within our own program and our own patients. As more donors came forward and incompatible pairs were approved throughout the process, this chain was identified and created. With all patients cleared to proceed, many department leaders met and prepared for these donations and transplants. The final testing was complete. OR rooms were booked in tandem for 10 surgeries in 2 days. Hospital beds were reserved for these patients on our specialty transplant unit, and our teams were excited and ready. While the logistics of coordinating this transplant chain can present unique challenges, our nurses, doctors, and multidisciplinary team members are truly honored to care for these patients throughout their evaluation, recovery, and for years to come. Thank you.
I want to thank you all for coming, and I want to thank my colleagues for all their hard work. This could not have been done without our donors and without the hard work with not just the people behind me, but a whole litany of people upstairs that work very hard here at the University of Kansas Health System. We're glad to take any questions.
So this is not something you typically do on a daily basis, something like this. As you said, it takes a lot of planning. What's it like for you as a doctor to perform a surgery like this? How do you prepare, and how does it make you feel when you're getting ready to do something like that?
So you're right, we don't do this every day. We do smaller ones than this. We don't do a 5-kidney chain. We do this every week. Living donation happens every week here at the University of Kansas Health System. But of course, this is unique since we had 5 people that got transplanted. It takes a lot. When you think about the donor operation, which I was involved with, I always tell people that you're operating somebody that does not need an operation. So it really ups the ante. They're here giving them themselves and putting great risk. So you just have to be up to the task.
Yeah, I mean, so you have these 5 donors and the recipients, and now 5 people have a kidney thanks to your work. I mean, how does that make you feel as a doctor?
Fantastic. This is what you go into this for, is to help people. And when you have good outcomes, all your hard work doesn't seem like hard work anymore.
Is there a way to simply explain the chain?
So,
We all know what a chain is, but simply what happens? How does it start?
usually it starts with one person who doesn't have anybody to give to. They're called an altruistic donor. And then we had people on our list who had someone who wanted to give a kidney to somebody, but they did not match with that person. So we found 4 groups like that, and one person kind of set off the chain where one person matched with the next person. That donor who didn't match with that person matched with somebody else. So it's kind of like a domino effect, where usually it starts with one person who just wants to give, or it starts with 2 people who happen to be an even match, where you can swap one for one pair. But in our case, it started out with a person who just wanted to give out of the goodness of his heart, felt like this was something he had to do, and we're all grateful for it. Going back to the surgeries, yeah, I think it's really what we enjoy doing. It's a lot of stress. I haven't slept good since 1999, since I started surgery. So we worry about all this stuff, but in the end, when you see the patients and you see their families and you see them happy and feeling well, I think that's really the reward that we get out of it. It's not something we like to do, but I think seeing the end result and seeing how we can impact people is really why we do this job.
Is a chain like this something you've ever done before?
We've done smaller ones where we took a kidney from somewhere else in the country, and it was a 3 or 4 person chain, but we have never done anything like this in our own hospital. I think just doing 1 living donation a week is our standard. Doing 5 in 2 days was very it's on steroids, living donation on steroids.
You said 5 and 2 days, so how much total time was there in the operating room?
On Monday, we were in the operating room till about 5, and then yesterday we were in the operating room till about 3 or 2:30. I mean, we started at about 8. The timing was perfect. You know, Dr. Kumer would be next door in one room, and he would start his case, and then I would be in the next room preparing the next patient. And so it was, as soon as he gave me the kidney, they clean, got ready for the next one, and then it just kept going for the first day, and then the second day we did the same thing.
I don't know who's best to answer this, but how long did you all wait for that last and final donor, and how did that last and final donor kind of make themselves available or apparent?
Who wants to take that? Amna?
So we had those incompatible pairs sitting there. And as Dr. Schmitt was saying, that one altruistic donor with the right blood type, usually O blood type is a universal donor. So he came along, and that started the whole domino effect. So all those pairs were actually sitting there waiting. So we didn't really have to wait for this to happen. We had those patients, and as soon as the altruistic donor came along, we were able to think about this chain. What took long was that because these are patients about to go on dialysis or on dialysis, the recipients, we needed to make sure that they were healthy enough for us to take them to surgery. So that was what took a couple of months to make sure that everybody is teed up, ready to go.
You mentioned that the donor had a type O blood, which is universal. Was that a game changer for you to have someone with type O blood offer their kidney? Or?
Yes, exactly, and that's why we're very appreciative for him to do that. We've had a few altruistic donors in the past, which were rare blood types, and we were not able to do it in a big chain like fashion. And just because of his blood type, we were able to.
What would you say to somebody who maybe has type O blood and hadn't even considered donating an organ or anything like that? What would you say to them to maybe see if they were a match?
Living donation is something that is very safe. These donors, when they walk in, they have to go through very rigorous testing. And we are very stingy and have very high standards all across the country to choose anybody as a living donor. So if somebody is interested, they will be checked out, and we have a very low threshold of saying no as a donor if they they're not as healthy as we want them to be. Living donation is a simple act, but it will make a big difference in the recipient's life. Getting a living donor kidney is the best thing that can happen to that patient. These kidneys usually are very healthy, they last longer, and they have very good outcomes. And in regards to a recipient, you can change their quality as well as quantity of life by doing that gift.
Sorry about that. How frequently do you see donors with type O blood? Is it something that you see a lot, or is it something that...
So we do. I mean, most of the population has either A or O blood type. It just depends. Firstly, even if they are O donors and they have a compatible donor with them, we directly do a match. So we're not able to usually start a chain. Usually they end up giving to their particular loved one.
How has this changed their lives? How is this gift, how has it changed their lives?
The recipients are doing very well. They're very excited to have these working kidneys and move on with their lives. And the donors actually are all very excited. Especially our altruistic donor, wanted to know how everybody was doing. They have this selfless act in them, and you can tell how worried they were about how the recipients were doing. So everybody is happy up there in the hospital that all patients are doing well.
And you just finished this, but looking back at it, how does it make you feel to know that this was successful and that you guys were able to change these people's lives? How does that make you feel?
As everybody said, that we are very excited. I think the excitement was this morning for the first time because we wanted them to do very well. And of course, you always worry that something can go wrong, which potentially a lot of things can. So right now, as everybody's doing well, we actually can feel the excitement. And we made a difference in these patients' lives, and hopefully they're going to continue to do very well.
Did they all have, all 5 of them, did they all have really similar issues with their kidneys? Was it all the same problem?
They were different. There were different age groups and different causes of kidney disease.
Did the first guy just show up and say, hey, I want to give a kidney? I mean, normally they have some kind of motivation, and if that's the case, is this a pretty rare occurrence? I can't imagine people lining up to.
Right. So the first guy actually, through media, through Facebook, he found out that a friend of a friend needed a kidney, and he actually came in for that person. That particular patient, fortunately, had another donor that was ready to go. And this patient felt that, oh, I think this process is reasonable. I want to help anybody. And that's how the process started. It wasn't just a random thought. He had a particular person in mind who already got transplanted. So he wanted to move forward. But we do have those altruistic donors who just hear about it in TV and want to come in and help other people.
Any more questions or anything that we can answer for you?
I'm good.
I just need you to say your name, or can you say each one of you?
Sure, we can do that. We can.
I'm sorry.
Sure.
Just go ahead and say your name and spell it.
Sure.
Please.
I'm Sean Kumer, SEAN, Kumer, KUMER. I'm Vice President of Operative Services here at the health system, and I'm also a transplant surgeon.
Thank you.
Tim Schmitt, SCHMITT. I'm the Director of Transplant here.
Okay. Both of you ladies, go on up.
I'm Diane Cibrik, CIB, RIK, and I'm the Medical Director of Kidney Pancreas Transplantation here.
I am Amna Ilahe, AMNAILAHE, and I am a transplant nephrologist and the medical director for a living donation.
Thank you very much. One more, sorry.
Hi, I'm Jaime Bartley. My first name is spelled Jaime. My last name is Bartley, Bartley, and I'm the nurse manager for the kidney transplant program.